Welcome to this conversation on vaccines and students, and all of our panelists today are students, and they're all studying public health at NYU School of Global Public Health. And a lot of you are student leaders too. Really excited to have all of you here today. We're going to cover a bunch of topics. Just as a quick overview, we're going to hear from each of you and whether you're going to get the vaccine. We're going to talk about what you're hearing from friends or students who might be a little worried or a little hesitant about getting it. We're also going to talk a little bit about the research and inequities. And last but not least, a little bit of policy, like should vaccines be mandatory for college students? That is a big topic of debate right now. So we're going to get to that. We're going to make you wait for that, but we will get to it. And stay tuned. But first, we're going to get some really quick intros. And Mary, I'm going to start with you.
Hello, everyone. I am Mary Holloman. My pronouns are she, her. I am a MPH student in the Community Health Science and Practice concentration, expected to graduate this coming May. And I am also the president of the Black Women's Health Collective.
Hi, everyone. My name is nyu.edu. I'm currently a second year in the Global Public Health program as well for my MPH. I am concentrating in management, and I'm also the president of our Student Governing Council.
Hi, everyone. I am Dalia Guba. I am she, her, hers. I am an MPH student graduating in 4 weeks. My concentration is health policy and management.
Hi, everyone. My name is Ciara Freeman. I'm a first-year student in the Global Public Health track at NYU. I'm also the Student Affairs, Career, and Alumni Graduate Specialist, and I'm the VP of the Black Women's Health Collective.
Hi, I'm Abby Jones. I'm a second-year doctoral student in epidemiology at GPH, and a lot of my research is in infectious disease epidemiology.
Hi, everyone. My name is Yang Wu. My pronouns is she, her. And I serve as the graduate representative as the Student Government Council of Global Public Health, and my major is global health.
And I'm Sapna Parikh, and my medical focus was in surgery, and my public health degree was in urban public health and community health education. And before coming to NYU, I was a reporter here in New York City for a long time, so I'm really excited to ask you a bunch of questions. Starting with, I want to hear from each of you. Are you going to get the vaccine, or did you get it already? And what led you to that decision? Why or why not?
I can go first. I got my second dose this morning for Pfizer's vaccine at Mount Sinai Morningside. It's something that obviously I really wanted to do. And the reasons why I got it were, although we know that, you can still contract and spread COVID even while you're vaccinated. So obviously still maintaining social distancing, wearing your mask and so forth. The vaccine helps protect yourself from a lot of the symptoms and a lot of the issues that you face when you do contract COVID. So it's something that I think that, I recommend for everyone if possible.
I have been partially vaccinated. I get my second dose this Thursday. I got the Moderna vaccine. I would like to lead by example. So for me, it was really important as a public health student who has been encouraging people to take the necessary precautions to prevent exposure to COVID and prevent exposure to others to COVID, to get the vaccine too, as a way of saying, I'm not just telling you to do this because I think it's right for you. I also think it's right for me as well.
I think going off of what Mary said, it's important to practice what you preach. I got my first shot of the Moderna vaccine last week and had really no issues so far. I just felt a little fatigued. I was in bed a while, but nothing too serious. And I look forward to getting my second shot too, so that, the sooner we all get vaccinated and reach a level of immunity, the sooner we can finally put this pandemic behind us and move forward without fear.
So I took my 2 doses of vaccine. So the second one about 3 weeks or a month ago. I took it because I'm a healthcare worker, but also primarily because I think it's the responsibility of every citizen. I think we all have to play our role for the common good. I think we all want that disease to go away. And the main tool we have right now to stop the spread of COVID-19 is really to take the vaccine. So I think at this point, every responsible citizen should take the vaccine.
I will get the vaccine as the international student because I think this is the right thing to do, like the duty under the pandemic. But I have not taken the vaccine because I haven't got any spot to take it. And also, before taking vaccine, I still had to figure out two concerns because I have the unexplained allergy reaction happens to me like annually. So I have to talk to like the allergy or immunology consultation before I taking the vaccine. And the second for me, because like the possibility of showing false positive, maybe in my past result after taking the vaccine, maybe this will restrict me from traveling back to my mother country. So because I haven't seen my family for more than a year, so this is like one of my concern also. But generally in the future, I will take the vaccine after figuring all of those.
And can you tell us where you are now and what is your home country that you mentioned?
Now I'm living in New York City and my home country is China.
And what about you, Abby? Are you going to get the vaccine or have you received it already?
Yeah, I received the first dose of Pfizer about a week ago. So I'm very excited to get the second dose in 2 weeks. I think for public health, it's really important to do what you can for yourself, but then also, vaccination is a population level intervention. So it's really only going to work if enough people get vaccinated. So it's not just for me, but it's also for everyone else.
So all of you have said you would get the vaccine. There's kind of a selection bias because there's all public health people. Can you talk about your friends or other students who you've heard who might be a little hesitant or a little worried? What are you hearing from them as to why they're concerned?
You have the people who are vaccine hesitant, but also, so I would call vaccine hesitant the people who have mistrust issues towards the government, the people who believes in myths and all that. But you also have the people, I guess, kind of like young, who are the group that I would call vaccine safety. So it's not that she's believing in conspiracy theories or whatever, but she does have valid reasons to be concerned and to see maybe how things play out for people in her group. Like if she notices that, hey, people with asthma are getting the vaccine and it's fine, then she's fine. So I think by making the parallel, we can kind of put the person in the bucket. And then based on if it's myth or if it's concerns like young, then we can find a tailored type of, way to address their concern.
I've been hearing things such as, how did we get a COVID vaccine so fast when we still haven't gotten a vaccine for HIV or cancer? And I think a lot of it mostly stems from like misinformation and a lack of understanding in general. Most people really don't know that COVID-19 is a variant. Scientists have been working on a vaccine for the virus that causes COVID-19 for years. And I feel like also when it comes to like things like medicine, it's not really understood how in order to create vaccines, you need funding for it. And when you have all the countries in the world pooling their resources together, of course, things happen a lot quicker.
I know that most of us are on, social media in some way or another. And I think a lot of people flock to that for information. And oftentimes a lot of things posted there aren't accurate or aren't true. I think I've also heard others say, oh, I'll just wait until everyone else is immune. Like, why should I get it now when other people are getting it? I can just wait and hold off. I don't have to be like a test subject or a guinea pig for the government or other things. And I think that's a very selfish point of view because it takes all of us to come together and be held responsible for getting us back on track. I think there's been some conspiracy theories about what's actually in the vaccine, whether there's some form of government tracking, or if the vaccine, I think there are questions about whether the vaccine can actually give a person COVID-19. And that's also a misconception because that's inaccurate.
We know that there's a lot of anti-media sentiment right now, and I think that has pros and cons in a sense. When we talk about being anti-media, it doesn't necessarily mean that you get to pick and choose necessarily like what's right and what's wrong based on what you want to see. It's making sure that the organizations that you follow, the studies that you look at, these are things that are verified or supported by groups that have authority, that have a voice and have, establishment in a scientific community or rapport. I think that's the most important thing. People just aren't sure. As we know, the vaccine right now, when we talk about Pfizer, for example, it's for emergency use. People are curious about what that means. They're wondering if they should take more time prior to, getting a vaccine. But we have to understand that even through emergency use, all of the time and effort that it took to put into this vaccine, that gives a rapport. And, we have to be able to trust that as well, as these are the communities that support our, reputation in terms of science. But those are my thoughts on it.
Abby, I'm going to come to you next to talk a little bit about the research. People, as Nick mentioned, people might be worried about that these were rushed. Some others have mentioned that too. People might be worried about the side effects. And I know you're on the epidemiology track and you just took a class that really looked at some of these vaccine studies. Can you talk a little bit about the research?
Yeah, so the COVID vaccine trials, when we talk about trials, those were randomized controlled trials, so RCTs. And those are basically the gold standard for any sort of medical or public health research. When you do a vaccine trial like that, you do all of the safety and side effects phases first. And then when you get in to the phase 3 part of the trial to see how effective the vaccine is, usually what happens is it takes years to do that part. So you have to recruit people. You have to wait until the disease is spreading at a certain level in the community to even see if it works. And then you have to go through a full approval process once that's done. So with COVID, there was a lot of interest for people to volunteer for these trials. So they got tens of thousands of people to volunteer right away. So that took away some of the time that you usually would have in a trial where it would slow things down. And also because the transmission levels in the community were so high, it was really easy to see that the vaccine works. And the emergency use authorization, what that means is that they were allowed to produce the vaccine while they were still testing it. So normally the full approval process would be that they would have to go through the entire trial, get approval, and then they could make the vaccine and then distribute it. So with the emergency use process, it allowed them to do all those steps at the same time. So if the trial showed that it worked, they'd be ready to distribute it. So when I first heard that they were going to have a vaccine in a year, or that was the plan, I kind of didn't believe it, but I think that because of the unique situation that we're in, it was able to happen so quickly. And I think that that is scary to a lot of people, but the way that the vaccine trial was structured, it didn't skip any steps. It just was able to kind of speed everything up and also kind of do multiple steps at the same time in order to get the vaccine out quicker.
There has been some recent news about young people and COVID. And when young people do get COVID, there has been something called the COVID long haulers, which are where people that contract the virus then not only have side effects once they get the virus, but also longer, like in years and months later, they may contract or they may experience issues of brain fog or loss of taste and smell, and they may have these long-term side effects from getting the virus. And personally, I don't want that to happen. And so I'm doing everything I can to prevent that happening with, the vaccines having 95% efficacy in, preventing this virus.
That's a really important message, especially for young people, because you might think COVID-19 is not that serious. I might not die from it, but those long-term symptoms and everything else that might come along with it, plus the concept that so many of you have said that it's not just about me as an individual, but it's about all of us working together.
I think there's something about the trials population that is making people, especially the BIPOC community, hesitant, because at some point when they published the proportions of each demographics compared to the general population, we noticed that the number of Black people, actually I'm going to say Black and brown people that were involved in the communities were not proportional to the percentage of these communities in the general population. So I remember Dr. Fauci had to answer questions about what's going on with this. Like, why couldn't you find more Black and brown people to actually take part of those trials so we can see if it's actually working on those, on that population? Yeah. So I think this is playing a factor in hesitancy for the BIPOC community.
And let's just stick with that topic of minority communities, since you brought that up, and just starting with specifically Black communities. Sierra, I know you help lead the Black Women's Health Collective at NYU. And initially, the hesitancy in the Black community, people thought maybe it's a historical lack of trust because of stories like the terrible Tuskegee syphilis trial. And then there's newer research suggesting that the Tuskegee scenario is not necessarily to blame, that there are modern factors playing a role. There's inequities now. There's a overall distrust. There's lack of access. So a lot of different issues, but I want to hear from you. What are you hearing about hesitancy in this community?
Right. Well, I think those are all extremely valid. I think, I read somewhere that Black and Latino people are more skeptical about this due to this historic mistreatment, specifically regarding the Tuskegee study, where, if you don't know, Black men were recruited into the study, and they essentially had untreated syphilis, and they were not offered penicillin, which is a drug that treats syphilis, and they weren't offered this, and so they weren't fully consented to the study. And this happened years ago in the 1940s, but we see this kind of play out in the modern day, where I'm learning in my classes that Black people and other people of color are being treated so poorly in the medical field, and they aren't given the same resources. There are just so many injustices in the medical field.
So when we talk about the Black community, I think it's very important to desegregate, because the Tuskegee study cannot be a factor for my vaccine hesitancy, because I don't even know it, unless I learned at school, or I don't know, unless I learned from other people what happened. Is just not my experience. But in New York City, we know that a great percentage of the population is actually immigrant, up to 40%. So I think it's important to desegregate those groups. When we're talking about the Black community, are we talking about the Black from Africa like me? Are we talking about the Black Caribbeans? Are we talking about the Black from other continents? But I think putting everyone in the same bucket and addressing the same way cannot work. We need to be focused, and we need tailored interventions for each of those groups.
And an interesting historical fact, or surprising, I thought this was surprising, that it wasn't actually until 1993 that the National Institutes of Health required by law that women and minorities be included in clinical studies, which I think is really recent. I know I'm older than probably most of you, but 1993, so until then it wasn't even required by law. And Young, I want to hear from you as an international student. Are there any particular issues or concerns that you're hearing about?
This is very interesting because asked one of my friends yesterday. I just asked her, will you take vaccine or not? And she answered me she didn't want to take vaccine because she heard her friend had a severe illness after vaccination, because this is like the person who happened this and around her. So she just take that because just like, I think this is like just the Nick said before, it's really a matter for what kind of news you are looking for. And I have also asked a bunch of my friends who are not studying in public health field, who maybe study like in business, in financial, and in economics. I just asked whether you do not choose to take the vaccine, because some people, they will mention about the vaccine efficacy among the Asian people, because there's like some news toward that the vaccine is not effective for Asians. I think no matter this is true or not, I think it's like kind of a question about the true trust.
What did you say, or what might you say to some of those friends who were hesitant?
I will say that because sometimes I will just hear about their feelings, but for me, because I will choose to take the vaccine, I think the action is really important. It's the most persuasive way during this conversation. If you want to encourage people around you, or just not like encourage, I just show my attitudes. If people, they trust you, they will maybe have a try.
So as of right now, several prominent research universities have made the COVID-19 vaccine mandatory for college students, and it's being considered by colleges across the country, including NYU. And on the one hand, you know, many colleges and hospitals where some of us have worked require certain vaccines, and then others are saying, well, it's an overreach and it's a logistical challenge. What are your thoughts? Do you think the COVID-19 vaccine should be mandatory for college students, and why or why not? Pros and cons.
Of course, I'm more inclined to think that it should be mandatory, just because vaccinations have kind of been required our entire lives, starting from when we were babies and all the way up into college. Even for graduate school, I had to submit paperwork showing that I was vaccinated. And if I didn't have certain vaccinations, I had to submit documentation explaining why I opted out. But I also think when it comes to making sure that it is mandatory for college students, it's just understanding that college students come from all over the world. Even we have this problem in America when we see like different states have different guidelines for who's even eligible for the vaccine. Like, I know for me, it was relatively easy for me to find an appointment. It's so many pharmacies and doctor's office and makeshift clinics that are offering them. But for my parents who live in a rural small town, the nearest place to get a vaccine is 45 minutes away, and that's if you have a car and can drive. If you don't and there's no public transportation, your resources are limited and your access to even get one is limited. And I feel that to make it mandatory for college students, we also have to look into those factors as well and make sure, okay, if we do require it for our college students, what are colleges doing to make sure that every student can be vaccinated?
I think, you know, in theory, it makes sense. There are a lot of vaccines that are mandatory for college students. I think before we say it's mandatory right now, I would have a few questions, and it would be kind of, again, related to what Mary was talking about access and where people are coming from. And then also, NYU has a lot of international students, and I know that different vaccines are being offered in different countries. And I think, you know, a lot of different countries have very different rollout plans. And then also, if they, you know, need to make booster vaccines for different variants, what will that look like? So, I mean, I think in theory, I think the idea makes sense, but I would have a few questions before I would say that I think it should be done immediately.
Also, a topic of debate right now are vaccine passports, which are essentially digital proof that you've received the vaccine. And Nick, I was going to start with you because I know your career and focus has sort of been at the intersection of health tech. and health policy, but I want to hear from others too. New York, for example, has the Excelsior Pass wallet. Airlines and entertainment venues are testing out these digital passports. And then on the other hand, Florida and Texas governors have banned them, saying you shouldn't have to disclose your health information before going to a concert or living your everyday life. What's your take on vaccine passports?
I think the conversation is the same as our previous one. It makes a lot of sense to me. And personally, I'm not going to get into what those governors said because there's a lot to be said about that. But these are organizations, these are businesses. If they feel like they want to protect their patrons, they want to protect the people participating in their events and their activities, then I think it's up to them. And I think it makes total sense from a public health standpoint as well. Just reducing super spreader events. If you want to be able to have these events in general, should people and can people feel that they're safe to be able to go to them? And I say yes.
So within the country, I'm not sure, but the electronic passport for traveling, absolutely yes. Like I'd be so mad at the US government if they actually don't do that, because everything started abroad. So either it's in Europe, either it's in Asia, it came from somewhere. And right now they're struggling in Europe. So we're not gonna be vaccinated here. I guess a couple of people are not going to be vaccinated, and they're just gonna start traveling and bring it back to our borders. And we don't even know how long we are immune for. So for me, the electronic passport to travel is an absolute yeah.
I think personally, my opinion is that the vaccine passport for certain things, like if you want to go to a large concert or something like that, that can make sense. I think when we start talking about everyday activities, to me, it kind of seems like the messaging is lost there. I think really what we want is for everyone to be vaccinated to end the pandemic and to stop the spread of COVID. And I think, independent of whether or not the vaccine passports are a good idea or a bad idea, I think I worry that some of the media coverage of things like that kind of detracts from the whole point of getting the vaccines. And, it's really not because I want to get a vaccine so I can go out to dinner during a pandemic. It's like I want to get the vaccine to help stop the pandemic and help stop the spread of the disease. So, I think that it's an interesting idea. I just worry that some of the conversation kind of detracts from kind of the basic public health messaging.
There's so much messaging out there for young people, for students. There's Instagram videos and Instagram stories and stickers. There's PSAs.
We miss your point of view. So you have to tell us at least for 1 minute, what do you think about all this?
What are my thoughts on the vaccine? Yeah, thanks for asking. I, as you know, am a public health and medical person. In addition to what I do now, I have a science background, so I believe in the vaccine. I also did a lot of my own research. Like I was a skeptic as well. And so I looked at the data myself. I looked at who was getting it. I'm still looking at some of the side effects that are coming out or being questioned with some of them. But I did get 2 doses. I think it's not perfect. I think we need to watch what happens with these variants. If a booster shot perhaps might be needed, if the proteins are shifting and the efficacy is not as much as we thought or over time. But I just think it's the best thing we have. It's imperfect, but it's the best thing that we have. And we just got to keep moving it forward. So I'm a supporter in that way.
Thanks for sharing.
Any last thoughts on messages, myths, anything else you think students need to hear?
Yeah, as one note, if anyone is still hesitant to take the vaccine, I encourage you to talk to the people that you trust, not only just other people that may be hesitant, but also people that may have taken the vaccine. I think it's important for you to be able to consider all of the experiences that people had, and hopefully the conversations that we had today helped guide your decision a little bit as well.